One of the features we're really excited about with the NHS is to release our reporting dashboard. So what you'll see here is the ability for both practitioners and the organisation to see the analytics around the number of sessions, both the sessions generated, those not completed yet, the average versions per session, the total number of medical letters, and the total patient summaries. So you can see down here how they're created via new session or via dictate. The most commonly used prompts for that practitioner, both of clinical notes, letters, and reports, as well as a reporting here per session per day. You can also see the number of completion time. So what that tells us is that if somebody's rushing it too much, it can actually be prone to laziness. Whereas if they're actually reviewing and taking the appropriate time to review them, then that's going to then give better clinical reasoning in that process. Now that can be by user or across the organization. So we can filter those by practitioner. We can then see, again, the information being generated, and then all of those different analytics by device, browser, iOS or Android, as well as who is the top session in the last 30 days. So that would be available just to users with administration, obviously access, looking at organization, but at an individual user level, it also helps with that. So if we then go back and had a look at some of the sessions that we had here, you'll see some of these weren't actually completed. So if I then mark those as completed, that will then change around the metrics. If I did a dictation session, Sarah hit her left little toe and sustained a compound fracture. We'll organise orthopaedic review and an X-ray. So then if we came back into that dashboard, we're now going to then see, under the reports, we're now going to see that we've now got a dictate session appear. So it's now a sort of 5-to-1 ratio. So hopefully you'll see that the analytics can hope to drive better outcomes, both clinical as well as practitioner in the use of AI scribing.